I recently had a chance to sit down and talk with Dr. Jonathan Oberlander. Dr. Oberlander is one of the country's foremost health policy experts, and he's written and thought a lot about the new healthcare reform law. Dr. Oberlander and I discussed one aspect of that law, why the Democrats are having such a hard time selling the law, and what they might do to change that.
I mean, I think the important thing to focus on is it's an ongoing battle. I think what's important about the 6-month landmark and then the milestone of these provisions going into effect is you start to see a number of the more popular provisions, the more incremental provisions that help people with insurance who can keep their kids on coverage to age 26, who no longer will be subject to insurance companies retroactively canceling their coverage in rescission. Those sorts of things, I think, are the parts of health reform that haven't gotten a lot of attention. And if somebody is clever about it, can package them together and really sell reform to the insured. And I don't think that's been done in a very compelling way so far.
And has that created some problems for Democrats?
Yeah, I think so. If you look at the polling, some Democrats expected or maybe hoped for a bounce after health reform passed, and they got a little bit right after. But since then, it's gone back to what it was before, which was the country being very divided about health reform and more people against it than for it, if you take the average of the polls. And once you had all that stuff out there about death panels and pulling the plug on grandma and all these other myths about reform, they're very hard to get out of people's head. And I think one of the ways you can counter that is to start by highlighting how this is really going to work and how it's going to help people not just without insurance, but people who already have coverage. I think there are two problems. One is that this is going to be phased in actually over a decade. The last provision goes into effect in 2018. And because it's such a slow rollout, it affects different groups of Americans in different ways at different times. And that makes it very difficult to tell a coherent story about health reform. It makes it more difficult to sell health reform. The other problem that I think is fundamental to this is not a program. This is actually a law that doesn't really have a name. It doesn't really even have a good acronym or abbreviation. Social Security and Medicare are specific programs that target very specific demographic groups and give them very visible benefits. This law is a series of programs, regulations, mandates, and policies. And it's disconnected. It's very hard to explain the connection between people who have insurance getting lifetime limits on their benefits removed versus providing subsidies to the uninsured in 2014 to go into exchanges. It doesn't feel, I think, to those people that they're unified under one program. So the fact that this really doesn't have a name, an Affordable Care Act, I don't think cuts it. I think really gets to the heart of the matter, which is this is not a single program. It's not a social insurance program, and that makes it harder to sell.